When we talk about the deadliest viruses in modern history, COVID-19 is the first name that comes to mind. It spread across the globe, infected hundreds of millions of people, and changed the way we live forever. But there is another virus that scientists fear even more in terms of lethality, the Nipah virus. It has not caused a global pandemic, but for the person who gets infected, the risk of death is dramatically higher. So, which is actually more dangerous, Nipah or COVID-19? To answer that, we need to understand two key factors: how easily a virus spreads and how deadly it is once it infects someone. Let's start with the fatality rate. COVID 19, especially in the early waves, had a global fatality rate of roughly 1 to 3%. With vaccines, prior immunity, and improved medical care, that number dropped significantly over time. Nipah virus is on a completely different level. Its fatality rate ranges from 40% to as high as 75%, depending on the outbreak and the speed of medical response. In some clusters, nearly 3 out of every 4 infected patients have died. That makes Nipah one of the most lethal zoonotic viruses known to infect humans. So, on an individual level, Nipah is far more deadly than COVID 19. But if it is so deadly, why didn't it spread across the world like COVID 19? The answer lies in transmissibility. COVID 19 spreads through respiratory droplets and aerosols. That means it can spread simply by talking, breathing, or being in a crowded indoor space. Even people without symptoms can transmit the virus, which made it extremely difficult to control. Nipah virus does not spread that easily. It usually spreads through direct contact with infected animals such as fruit bats or pigs, through consumption of contaminated food like raw date palm sap, or through very close contact with an infected patient, especially in healthcare settings. Human to human transmission is possible, but it typically requires prolonged and close exposure. So, COVID 19 is highly contagious while Nipah is much harder to transmit. Now, let's look at how these viruses affect the body. COVID 19 primarily targets the respiratory system. Most people experience mild to moderate symptoms such as fever, cough, fatigue, and loss of smell. Severe cases can develop pneumonia and respiratory failure, but the majority of patients recover. Nipah virus is far more aggressive. It attacks the brain. Patients initially develop fever, severe headache, muscle pain, and vomiting. Very quickly, the infection progresses to acute encephalitis, inflammation of the brain. This leads to confusion, seizures, reduced consciousness, and coma. Many patients deteriorate within 24 to 48 hours after neurological symptoms begin. Even those who survive may suffer long-term neurological complications, including personality changes and persistent seizures. Some survivors have even experienced delayed relapses months later. This neurological involvement is one of the main reasons Nipah has such a high mortality rate. Another major difference is treatment and prevention. For COVID 19, the world developed multiple vaccines in record time. Antiviral drugs, oxygen therapy, and improved ICU management dramatically reduced death rates. For Nipah, there is no widely available vaccine for public use and no specific antiviral treatment. Medical care is mostly supportive, maintaining oxygen levels, controlling seizures, and managing brain swelling. This lack of targeted therapy makes every Nipah outbreak extremely dangerous. However, Nipah outbreaks are usually small and localized. Rapid isolation of patients, strict infection control, and contact tracing have helped contain the virus before it could spread widely. That is why, despite its high fatality rate, Nipah has caused far fewer total deaths than COVID 19. So, from a global perspective, COVID 19 has been far more destructive because it infected millions of people. But from an individual risk perspective, Nipah is significantly more lethal. In simple terms, COVID 19 is a high transmission, lower fatality virus. Nipah is a low transmission, extremely high fatality virus. Scientists are particularly concerned about Nipah because it is an RNA virus with the potential to mutate. If it ever becomes as easily transmissible as COVID 19 while retaining its high fatality rate, it could become one of the most dangerous outbreaks in modern history. That is why the World Health Organization lists Nipah virus as a priority pathogen for research and vaccine development. So, which virus is more deadly? For the world, COVID 19 caused more deaths because it spread to every corner of the planet. But for a single infected patient, Nipah carries a much higher risk of death. Two viruses, two very different threats. One spreads fast, the other kills fast. And in public health, the greatest danger is always the virus that can do both.